Today, I have a question from William who asks, is there any way to move my mother that is in intensive care to intensive care at home to survive/pass in their own home with CRRT, vasopressin, epinephrine, and other medications? If so, what do I need to do? My mother doesn't want to die in the hospital and it's not looking good. Can you help? My name is Patrick Hutzel from intensivecarehome.com. And today I'm here to answer William's question. So first off, let's clarify some terminology. William is asking whether his mum can go home from intensive care to intensive care at home to survive pass in her own home with CRRT. What's CRRT? CRRT stands for continuous renal replacement therapy. Basically, is hemofiltration or hemodialysis for kidney failure. He also asked if she can have vasopressin, epinephrine, and other medications. Vasopressin and epinephrine are vasopressors and are used to titrate a blood pressure that is compatible with life. So it's usually used for really low blood pressure. And he's referring to other medications, but he hasn't been specific what those medications are. Now, William, in a nutshell, yes, we can do that. If you want an end-of-life situation on your terms at home and not the one-size-fits-all end-of-life situation in intensive care, then absolutely yes. Here are some interesting statistics as well. Research has shown that 75% of the population in Western countries want to die at home if given a choice. And yet, less than 15% apparently are dying at home. So that means our hospital systems in Western countries, whether that's in Australia, in the US, in the UK, we're not meeting our population's needs when it comes to end of life or palliative care, right? So you're asking a very relevant question here, and you're just asking from, as far as I'm concerned, a very common sense question, right? Where do people want to die? If they do die, do they want to die at home or in a hospital? Well, it's rather simple to say they want to die at home. So next question then that comes out of this, have we done this situation? Yes, we have. So, managing CRRT, vasopressors, and other medications at home for an end-of-life situation. Yes, we absolutely have done that. And we can do so for you as well. And keep in mind, the cost of an intensive care bed is around $5,000 to $6,000 per bed day. You got to let that one sink in. It's $5,000 to $6,000 per bed day. And it's the most sought after bed in a hospital is the intensive care bed, right? So actually taking your mum home for end of life, if that's what it is actually a win-win situation, right? So, and also as another sort of anecdote here, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse unit manager in intensive care for over 5 years. And I've been running intensive care at home since 2012. I've been working with intensive care at home, even 20 years ago in Germany. So I have a lot of experience here. And I can tell you from experience that, if I had $1 for every time in intensive care where families have said to me and to other health professions in intensive care as well, if we could only have end of life at home, those dollar coins would have accumulated very fast. And I always thought and I always believed there must be a better way to provide palliative care or end-of-life care. And I do believe that hospitals and intensive care units need to listen to what clients or patients and families have to say, right? And make it a win-win situation, because the intensive care unit also needs a bed, and they need a bed desperately, right? So again, it's a win-win situation. So William, I encourage you to reach out to us, at intensivecarehome.com. Call us on one of the numbers on the top of our website, or simply send us another email to info@intensivecarehome.com. But at this stage, I think we need to talk to move things forward. So to wrap this all up, With intensive care at home, we are providing 24-hour critical care nurses at home, and we are providing a genuine alternative to a long-term stay in intensive care for predominantly ventilation, tracheostomy, adults and children, home BiPAP, home CPAP ventilation without tracheostomy, tracheostomy care without ventilation, home TPN, home IV potassium infusion, and home IV magnesium infusion. We're also providing ventilation and tracheostomy weaning at home. We're also providing palliative care at home. We're providing port management, central line management, PEEK line management, as well as Hickman's line management. We're also providing nasogastric tube management and PEG tube management at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of a program at the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to the emergency department. With intensive care at home, we're also in a position to cut the cost of an intensive care bed by around 50%, because intensive care beds cost around $5,000 to $6,000 per bed day. Our service costs around $2,500 to $3,000 per bed day, and we're freeing up an ICU bed, which is the most sought after bed in a hospital. So it's a win-win situation all around, not even mentioning the improvements for quality of life and for quality of end of life for patients and their families, which has always been at the core of what we are doing. With intensive care at home, we are currently operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider all around the country. TAC and WorkSafe in Victoria, ICARE in New South Wales, NIISQ in Queensland, the Department of Veteran Affairs all around the country. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. Intensive care at home is the only service provider in Australia in 2024 that has achieved third-party accreditation for intensive care at home nursing. We have been achieving this level of accreditation since 2012, which is how long we've been in business for. No other provider has achieved this high level of accreditation in the community and has created this much intellectual property for intensive care at home nursing than we have. That puts us in a position to employ hundreds of years of critical care nursing experience combined in the community for our clients. No other service provider employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community safely. No other provider in Australia can take on a higher acuity in the community than we can safely. And if you're at home already and you're watching this and you realize that you don't have the right level of support, I'll give you a very tangible example here. One of our first clients over 10 years ago was a client who was at home on a ventilator with a tracheostomy with a support worker model. Of course, support workers cannot keep looking after patients at home on a ventilator with a tracheostomy. That is like flying the airplane with the cabin crew instead of the pilot, because this client was at high risk of dying. He was going in and out of ICU because support workers simply couldn't keep him at home predictably. Of course not. They have no skill, no experience, no knowledge how to look after the ventilator and the tracheostomy. That is an intensive care nursing skill, period. Then eventually the client found out about us and we were providing our concept. We were proving our concept there very, very fast. And the concept is also around the mechanical home ventilation guidelines. If you look up the mechanical home ventilation guidelines on our website at intensivecareathome.com, you will see that they are evidence-based, and the evidence clearly says that only critical care nurses with a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care qualification, can safely look after clients at home on a ventilator with a tracheostomy, with or without ventilation, with or without tracheostomy. So BiPAP, CPAP without tracheostomy is also included there. Tracheostomy without ventilation is also included in there. So our services are actually evidence-based. So when we started working with a client, he never ever went back into ICU ever again, and he was safe. We can do the same for you if you're not safe at home. If you don't have enough funding, let us do the advocacy. Let us help you, because otherwise we wouldn't be in business. We have always successfully advocated for our clients. That's also why we're providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators, and they have a wealth of knowledge. I will put into the written version of this blog an interview that I've done with Amanda Riches, which is one of our NDI support coordinators, we're also providing TAC case management and WorkSafe case management in Victoria. And if you're an NDIS support coordinator or case manager from another organization watching this, and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and want evidence to provide, I encourage you to reach out to us. We can help you with the right level of advocacy. We also provide NDIS specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you are a critical care nurse and you're looking for a career change, we're currently hiring for jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Victoria, in Geelong, in Victoria, and in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years pediatric ICU ED and you have already completed a postgraduate critical care qualification, we will be delighted hearing from you. I have a disclaimer because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients want to have the same staff coming over and over again because they are very vulnerable and very special. So that's why we need regular staff. So if you're looking for agency work where you can come and go, this is not going to be the right fit for you. We're looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts, and if you're keen on building relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We are currently expanding our medical team as well. We can also help you eliminate your bed blocks in ICU and ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it's much more cost-effective than what you're paying in ICU or ED for. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, we want to hear from you as well. We can help you fast. And if you're in the US or in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell. Share this video with your friends and families and leave your comments below. What do you want to see next? What do you think about today's topic? And what insights you have from this video? Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care.